Human resources should definitely be involved in thinking about crisis management and disaster response. They're the ones who probably have the sensitivity to talk to each employee individually, sometimes maybe quietly, about problems they may be having. And again, this also could be an invisible problem, right? Imagine you've got an employee who has a mental health issue, and when the power goes out, it might be triggered. Or they might have flashbacks to previous shock they've been through, whether it's a flood or a fire or whatever else, that again, no one else in their employees would know about, but HR might know about if they're trusted. So absolutely, I think HR should be involved from the very beginning, helping to think through who are the individuals in the firm who might need help getting down the stairs, who might be triggered mentally by the power going out or by a fire or by some kind of event here in the workplace or by a shooting, for example. I know when I was at Purdue, for example, Purdue University in Indiana, unfortunately, there was a shooting during my time there right next to the building next to me. Someone was killed. I know some of my workers, some of my colleagues there still to this day feel a sense of trauma. And of course, if they see a gun, if they hear a gunshot, it instantly reawakens in their mind that moment when a student was killed on campus. And for them, no one else knows about it unless they've had the conversation. Okay, well, if there's a shooting on site, God forbid, if there's a fire, what kind of things might be a trigger for you? How can we help in that moment? How can we get you out of here safely? How can we help you respond safely? And of course, the other thing to think about is it's not just that there's going to be a fire or a shock or a pandemic that will affect the firm. For individuals who have been through this before or individuals who are vulnerable, that ripple effect might last for a while. It might be more than just an hour or two. They might be have to take off a week from work to find their mental health again, or go back to therapy again, if they've had PTSD from a previous shock. And certainly by speaking of first responders, a number of the people on the front lines of these firms, people have to be there, they may have trouble sleeping at night. They may be feeling anxious regularly, and that HR would be the people who could guide them to a therapist or some kind of process of helping work through that anxiety and that frustration.